curious, Sydney, did you find that you are using less moisturizer now that you have tried Skin Booster? Because it's supposed to be hydrating, right?
Actually, no, though. I still have a very strict skincare routine that I stick to because I vain.
Skin boosters are gaining popularity in Singapore, but what exactly are they? Are they fillers? Are they skin healers? Is it skincare? Hi, I'm Kayman, and we are on another episode of Spilling the Tea with Halley. Today, to discuss the topic, we have Dr. Terence Tan from Halley Medical Aesthetics. Welcome, Dr. Terence Tan.
No, thank you for having me.
Yeah, and at the same time, we have Sini, who has tried many different skin boosters, and we're here to get some insight on her experience.
Hi, I'm Xingyi. I'm someone with very dry skin. So I tried not many, but 3 different types of skin boosters before.
So maybe just to get started, Dr. Terence Tan, can you explain to us what is skin booster?
Well, skin boosters are generally products which are injected onto the skin to improve the quality of the skin. So generally, I think you can group them into 3 main categories. So number 1 would be probably the oldest type, whereby these are hydrating skin boosters, whereby if you inject it to the skin, it's a bit like wearable makeup. So you have better hydration, so your skin quality looks better, your skin's a bit thicker, pores a bit smaller, and you look brighter and more radiant. But lately it's been quite interesting because there's a lot of innovation in terms of our skin boosters which are available over here. And you have got 2 more types. Another type would be a collagen-stimulating skin booster. These products are as per normal injected into the skin, but they stay on the skin and they stimulate collagen through a process which is quite complex. Yeah. And lastly, there will be regenerative skin boosters, whereby these skin boosters are also injected, but by themselves, they do not stimulate collagen. They are actually signaling mechanisms deep within the cells and outside the cells to tell the body to regenerate. So these are some new developments in terms of skin boosters.
Actually, it's sounds quite complex. I don't know about you, Sini, when you went to see the doctor for the first time, and then you hear all this. How did you feel actually?
Actually, I've never heard all this. What happened when I went to the doctor was I already did my research on the internet. So I kind of found the most popular thing that was trending at that moment, and then I just went in to ask for it. And then if the doctor thinks that I'm suitable, then I just went ahead.
Okay, so actually, what types have you tried based on what Dr. Tan has
I
mentioned?
tried, the first one was the PNHA skin booster. The second one was the HA bioremodeling skin boosters. And the last one that I tried, which was only like a couple of days ago, I did the new Korean ECM skin booster. I think that's the trending thing right now.
Actually, a lot of popular things come from Korea. No? How do we
know,
decide
right?
which one is for us? Do we try the most popular? My friend tried the one from Korea, so I should try this one.
Exactly.
How do we decide?
How do I pick?
Yeah.
Wow, that's a very good question, yeah. I think even doctors have some problems trying to decide what to do. So I think firstly, our group of patients, or rather patients in general, are getting smarter and smarter. Our IQ is getting better from generation to generation, and also information available through the internet and now AI is really tremendous. So a lot of people that they come in, they've already done their research, right? And they know what they want. So for example, the first category, hydrating skin boosters. These are hydrating, so good for what you said, dry
My
skin.
very dry skin.
That's right. And healthier skin is hydrated skin. So the skin looks brighter, more radiant. The pores look smaller. Even the wrinkles get plumped up a little bit, and it looks better. And this is good for people with dry skin. And generally speaking, who doesn't want to look more radiant? Hands up, who wants to look more radiant?
Yeah.
Oh, wow. Surprise. However, sometimes we want to have a little bit better effect in terms of skin tightening, in terms of reduction in pore size, wrinkles, rejuvenation, and looking a bit tighter and younger, contouring our face maybe just a little bit. Then I think the category 2, which is collagen-stimulating skin boosters, and category 3, which is regenerative skin boosters, are really perfect, right?
Okay.
So they work in slightly different ways. So it really depends. If you want something which is more collagen stimulating, in terms of tightening, in terms of pore reduction, facial contouring. I think collagen stimulating skin boosters are probably the best. And for regenerative skin boosters, generally is anti-aging, right? So it's tightens the skin, improves the pores, but there are a lot of other processes that come into play, and generally, it's those people who want to look younger who would benefit the most from it. But they're pretty close. I think they kind of overlap quite a bit. In fact, all three categories overlap because when you talk about categories 2 and 3, a lot of them also have hyaluronic acid inside, which is a basic ingredient for hydrating skin boosters.
So they are like a 2-in-1.
Yes, that's right.
Okay.
The trend has been for people to be levitating towards categories 2, which is the collagen stimulating skin boosters, and category 3, which are regenerative skin boosters. But at the same time, there is some hyaluronic acid inside that gives some of the effects of category 1.
Right, I can't tell how old you are, seeing you look very young. But I mean, you've tried.
I like what you said though. I'm very old.
What do you like? I mean, what do you like about skin boosters?
I'm those kind with very dry skin, especially my under eye area, and after I put on my foundation, right, it sits into the lines, and then it looks very dry, creepy, and then I look very old. So I don't like that effect.
I can
You know
understand.
the
Yeah.
girls get it, right? The foundation lines, and I don't know how to describe. So and I look very tired all the time. So I read about skin boosters and decided to give it a shot since there's like injected hyaluronic acid.
I see. Actually, I'm curious, have you then tried fillers before or botulinum toxins? Because if we're talking about lines and looking very aged, right, Dr. Terence Tan, does it mean that, what Sini did is enough? We don't need fillers or we don't need any more botulinum toxins?
No, it's not enough.
Yeah, I think Sini was kind of correct. Not that it's not enough. Obviously,
Not enough.
yeah, I think so.
For beauty, never, it's okay to have too much.
Well, if you think it's not enough, I think the first thing you talked about is the difference between fillers and skin boosters. So I think they are, if you're talking about hydrating skin boosters, they are all made of hyaluronic acid, which is exactly the same as dermal fillers. However, the way it's done and the way it's produced is completely different. So fillers are generally injected deep underneath the skin to lift the skin such that the volume deficient areas and the areas with very deep wrinkles get pushed up. Because they're so far away, the hydrating effect of these fillers are generally not very obvious to most people. Okay. And for it to be effective as a hydrating agent, it needs to be injected on the skin itself. However, if you inject it on the skin, it needs to be produced in a way such that it's very, very soft. Because anything which is very superficial needs to be soft so as to look nice and natural. Otherwise, if you inject something really hard, sometimes it can look a bit unnatural, or even worse, it can look lumpy. Okay. So I guess while there's a lot of confusion, while they are exactly the same in terms of its chemical structure, it is manufactured differently and is used differently, and therefore it has got different kinds of effects. So these two actually complement each other. So skin quality is important as external of the face. You can look at it as an apple. So you need a nice crunchy skin on the outside. But at the same time, within the apple, you need a nice firm pulp. Okay? So if you want to augment the pulp, then you do dermal fillers. And if you want to improve the
skin surface,
the crunchiness of the skin on the outside, then you do skin boosters. So you have got the Dr. Terence Tan apple skin booster analogy.
Yeah.
Okay, so when I did skin boosters, of course I went to share with all my friends, right? Because good things must share.
Yes,
no
sure,
gatekeeping,
yeah.
right? So they were worried that it will change the shape of their face. So as Dr. Tan mentioned, only dermal fillers will.
Yes, I mean, yes, to an extent. Within the amount of skin boosters that you inject, even if it's hyaluronic acid skin booster, frankly speaking, it really wouldn't change the volume very much. Yeah, and sometimes this volume is important to thicken the skin. because it forms a bit more volume within the skin. It makes the skin a bit thicker, as well as more hydrated. And I think that's in a way a good volume, but the volume is really negligible, and it's really just to improve skin quality.
You know, there are those skin boosters that include all the other ingredients, like what you mentioned, like amino acid. I mean, I think the latest one that I heard actually includes amino acid. Actually, what is the benefit of adding all this extra non-HA type of ingredients into the skin booster?
Okay, so I think you're moving into category 3, which is rejuvenating skin boosters. Okay, so the concept is that we will use various products which affect the signaling mechanism within our cells itself. Okay, so it's a very complex kind of mechanism which I wouldn't really explain too much right now because it's really not that important to the lay person. But I would use growth factor as an example. So growth factor is very important as a rejuvenating signaling mechanism. It's a hormone that makes children grow taller as they're growing up, and for adults it's also important for certain regenerative processes. But the growth hormone itself doesn't really do anything by itself. It's a signaling mechanism. It's like the person holding the flag, flagging out the race or ending of the race. It's really just to tell people something, but the person is just staying there doing nothing. You can actually retrench him and have a robot do that.
So you're saying that the ingredient inside just tells the skin what to do?
Yes, that's right. So I say growth factor, but obviously growth factor has got a whole host of problems because it might not be hygienic, and it may not be approved for certain indications in various countries, and there's also an infective risk, which is the risk of having infection if you're using human growth hormones if used in illegal sources, or sources which are of ill reputable origins. So and people have been doing this for the longest time in terms of supplements, cosmetic products. Some people talk about placenta, but I won't dwell too much into that. However, then scientists have found that as long as you are able to tell the cells to do something or the body to do something, you need not have the same growth factor. So some of these innovations come from actually salmon DNA. Okay.
Oh, I know that one. That's the popular one.
Yeah, so it's highly purified salmon DNA. It comes in various forms. The form which is injected is called polynucleotide, or PN. I think you kind of mentioned it just now, right?
Yes, I tried the PN with the HA.
Yeah. So it is also here it's also present in cosmetic products which are applied. That's got PDRN. So it's polynucleodeoxynucleotide.
Oh, such a long name.
PDRN, yeah. Polydeoxy ribonucleotides. Yeah, PDRN, okay? So even higher problems, yeah. But PN is a bigger molecule and it kind of works better when it's injected. So it affects this thing called purinergic pathway, which happens to be also one of the pathways that growth hormone affects to cause or to give it its positive effects. So it's got a merit of regulating effects. So it regulates regeneration, it regulates growth, it regulates energy production, and a whole host of different things, right? So in a way, since growth hormone affects the purinergic pathway, and PN also does that, scientists have found that when doing research, it does a little bit of skin rejuvenation when injected, just like what we talked about when it comes to growth hormone. So that's what PN is all about. So PN also comes in various forms. It's suspended it's generally about 2% in most preparations, suspended in a gel. So the gel can be very firm, and sometimes doctors use that to help treat acne scars because it needs a firm product. It can be injected near the eyes, whereby you want a softer product for a natural look near the eyes, and the gel is a bit softer. Or it can be mixed with a little bit of, or rather it can come with a little bit of hyaluronic acid, such that you also have that glow. We talk about this hybrid of type 3 and type 1, regenerative and hydrating. So it comes in various preparations and is highly popular nowadays. In fact,
There are
I would-
different names to it.
Yes, different names, but I shall
Okay.
not talk about brand names today.
So it's for the eyes and then for the acne. Okay.
Yeah, that's right. So that's PN, okay? And then you also have other things. So I think you also talk about ECM or extracellular matrix, right? So this is also another innovation. So we find that if you were to put, actually ECM is actually what's present around the cells that supports the cells.
We already have that in our body.
Yes, we have. Yeah. So it's a bit like
okay.
a little cushion there, so that the cells don't bounce off each other and then stick together properly, So that's called the
Barrier.
ECM. Yeah. So
We need
in actual
boundaries.
fact, in actual fact, most of it is actually collagen. Okay. So, there's some evidence that if you were to inject ECM, which is mainly collagen, it acts as a scaffolding for more ECM and more collagen to be formed. Okay. So that's also a nice regenerative kind of skin booster. And there is probably also peptides. Okay, so you all talked about amino acids. So I think peptides is a more apt term for this, because peptides are just amino acids which are joined together in a long chain, and sometimes it's also a little bit spun around. Okay, so these also act as signaling mechanisms within and outside of the cell in order to stimulate a regenerative process, much like what we talked about when it comes to PN. So we had three main kinds. So you have peptides base, we have got PN base, and you got ECM base.
I see.
So it's exciting. I think none of these were available until really a short time ago. So with innovation comes progress, and with progress comes demand. So I think a lot of patients come nowadays asking for it. In fact, when we talk about skin boosters, especially category 3, it's probably the fastest growing and the most requested.
Doesn't that keep the doctors on your toes? I mean, you constantly get all these innovations
of
coming
new
in. It's
stuff
like all
coming
this,
in.
you're telling me about peptides, amino acids, and ECM. It's quite confusing.
Then one
Yeah.
question, since there are so many types and I want to reap the benefits of most of them, I don't think all is a good word. Can I do like different skin boosters in one session?
Generally, we don't. I think that we do see the body has a limit to how much it can improve and change.
Also
I
cannot
think-
be greedy.
Yeah, yeah. If you're really telling the body to do something, and then you're going to do something else, and you're going to tell the body, I think it's a bit of wasting of your money and wasting of
The
the
cells
effort.
get confused.
Oh dear.
Yeah, that's right. Yeah, let's just give it some time. I mean, life is short, but it's not that short. Okay?
Yeah, but we must make sure that we do it in a proper sequence, right? I mean, yeah. So
Yeah, so there's also there's also some evidence that certain types of hyaluronic acid may not do well with certain types of regenerative skin boosters, and I think having a right choice is very important, or choosing a right product which pairs these two up together carefully is also very important.
Okay.
Yeah, so I think it's important for us to make sure that the person doing the injection has the knowledge of, well, number one, the beneficial effects, but more importantly, how to prevent the problems of, skin boosters if not done properly.
I see. Actually, you mentioned something about, you mentioned the products, the PNHA skin boosters, but at the same time, it's also known as a skin healer. So I think there's some confusion in the market about, it sounds like it's the same thing. Is there a difference between skin healer and skin booster?
I think rejuvenation is really a healing process, right? So our skin is under a lot of stress, and there's always some damage through radiation, through natural aging, even through physical trauma. So I think the rejuvenation process is very much a healing process. So I think you can pretty much use it interchangeably, although it's not exactly the same.
Oh, so a skin healer is different from a skin booster?
A skin healer is a subtype of skin booster,
I see.
and that
Okay,
term
okay.
is used in a certain PN preparation, which belongs to category 3, which is commonly used, as a skin booster.
Okay.
Clinics,
Actually, curious, Sydney, did you find that you are using less moisturizer now that you have tried Skin Booster? Because it's supposed to be hydrating, right?
Actually, no, though. I still have a very strict skincare routine that I stick to because I vain.
I think that's correct, because I think that some people think that I just rely on the doctor will do everything. Yes, I think at most you see a doctor once a month, and the doctor can do something once a month. Albeit, if you have skincare, although a lot of people perceive it as being weaker, you can actually do it daily. So I think that's very
Yeah.
powerful as well, and you really shouldn't take away the personal responsibility once you see the doctor. Yeah.
But I do see the effects, and the effects are very visible after even one session. For my 3 different types of skin boosters that I've tried, I did 3 sessions for them each, I think 1 month apart. Even after one session, the results are very obvious. But I'm still very strict with my skincare.
For sure, but what made you choose? Because you tried 3 different types, right? But why did you not stick to one type? And then you were trying.
I need to try different kinds. That's one thing though. But then the first one I tried was the PNHA skin booster. So it was injected all over the place, and the dots were really in rows like that. And then of course the recovery took a little longer. But then the second time I went and I heard about the other type, which is the HA bioremodeling skin boosters, there were only 5 injection points on each side. So I thought that one easier, less discomfort, and then faster recovery. Do you recommend that, doctor?
Yes, actually, it's
Or are
actually
they
also
just
very
different?
no. I mean that specific bioremodeling skin booster consists of mainly hyaluronic acid. In fact, 100% hyaluronic acid. But through research, they found that certain forms, which are longer chains, and certain forms which are shorter chains, when bound together in a very weak manner, actually stimulates collagen production and an anti-aging process. And that's wildly popular. And the way it's reconstituted, or rather the way it is manufactured, is such that it spreads really, really well, such that it doesn't require such many injection points. Because basically, a skin booster need not be precise. A skin booster should be diffuse. Okay, so in order to make it even, you can either inject the skin booster in small intervals, which can be a little bit awkward in terms of downtime, or you choose a skin booster which spreads really well, such that you don't have to have that many injection points. So that brings me to the next point, which is how do you apply the skin booster? So because skin boosters can be done in many ways. It can be done via manual injections, or a lot of machines help improve the process by injecting in a certain way. So there are pros and cons whether you do a manual injection or you do a machine-based injections.
Is there like one is better than the other?
Yes, one is better than the other, but the other one is also better than one. Okay, so
I see.
yeah, yeah. So because when an injection is generally able to have smaller injection amounts and a little bit more superficial, I guess. In certain ways, it may be a little bit less painful than a manual injection. But manual injection tends to allow us to customize a bit. So very few people would say, oh, just the whole face is all the same. A lot of people say, I prefer a little bit more treatment near my jawline, my under eyes, my large pore areas. Is also able to deliver the product in a certain way, such as a little bit better for certain products. Certain products have certain attributes which lend better to certain injection techniques. For example, the bioremodeling skin booster that you talked about, it spreads really well, so there's no need to use a machine for that. Just a few injection points will do. So that's how it is.
I see. How about, have you tried both different types of injection method?
No, I only tried the manual kind. Have you tried actually?
Actually, I have tried skin boosters before, and when I first tried the one with the hand injection, actually it took then compared to the machine type of injection, I felt that the hand injection type of injection method took a longer time to recover. Is it always the case, or is it because of the product that is being used?
It's not always the case, yeah. Okay. So I think the injection based. I'm not sure whether you even need to know that, but injection with a machine requires a negative suction, a semi vacuum, in order to make sure that there's good contact between the needles, or rather the surface of the applicator and the skin, such that the needles penetrate in an even manner. And the negative pressure kind of increases the chance of bruising and bleeding. And there are also a little bit more needles because the injection quantum, or the amount that's injected, is really small. And a manual injection has a bit less points, so the chance that you nick a blood vessel is probably a little bit less. But in order for it to be really superficial, sometimes it can look a little bit bumpy for the short term. But there are injection techniques like going a little bit deeper that makes it a little bit less obvious. So I think there's no generalization in terms of.
I mean, to me, it doesn't matter because I understand that it's part of the process. I don't know whether you feel the same as well. Actually, in the long term, I like the results. So to me, it doesn't matter whether or not it's hand injection or machine injection. But I think at the end of the day, it's about trusting the doctor who is doing it for you.
Decide.
Yeah.
It's important to trust the doctor, but it's also important to trust yourself. Yeah. So I think a lot of people say, "Oh, you're a doctor. Why you asking me this kind of thing? Are you even a doctor? Why you asking me this kind of?" I think it's good. Yes, doctor is, the expert, but at the same time, the doctor doesn't know what you think. It's like I might be thinking that I'm going to a wedding tomorrow, and please,
better let the doctor know.
yeah. I think it's important to listen to the doctor's advice, but I think patients nowadays are smarter than a lot of
For sure.
people think. Yeah, and then you need two hands to clap. Yeah, so please communicate.
Correct. I mean, because with the internet, everything is so accessible. I mean, you did your research before going. I did
Yes,
my
always.
research. Yeah. So actually, both of us are ladies, and we've tried skin boosters. Is it just only for ladies? Can men do it too?
No, men do it. Yes, but I think in terms of beauty, health, beauty seeking behavior, I think women predominate. But that's not really because men don't really want to look better. But I think the health seeking and beauty seeking behavior is a little bit different. So in terms of men, I think the category 2, which we haven't talked about, is probably a little bit more popular. These are what we call about the collagen-stimulating skin boosters. Yeah. So men tend to have very rough kind of skin, and they are concerned with their pores and loose skin, right? So they want tight-looking face. They want smaller pores, and they want a nicely contoured face. So if that's the case, then I think category 2, which is a collagen-stimulating skin boosters, will be absolutely perfect. In fact, we kind of use a little bit more of these for them.
One question. Since it stimulates collagen, would these kind of skin boosters be able to replace skin lifting treatments like our therapy, prime, and energy treatments to the face?
It's hard to tell, but I find that different ways of attacking the situation generally leads to synergistic results, right? So if you are a very so first of all, I think personal preference is very important in that if the patient comes in, and we said that people are very smart nowadays, they generally have a good feeling for one rather than another through the research which has been done before coming to you. In fact, I think 95% of people, they've already done their research. So they come and they'll tell you what they like, and if they're a little bit shy, they won't tell you what they like. And they'll feign ignorance, but they'll know everything, right? Okay, yeah. So it's like testing the doctor, going for MCQ.
Do you have
MCQ
that?
is not the same as mine.
Always, do you always have
Yeah,
those kind of
Yeah,
patients?
then see you later. Bye bye. Yeah. Okay. So anyway, people are really smart. I think personal preference is key. After all, they all do a very similar thing to tighten skin, except I think skin boosters, especially those which have a little bit of hyaluronic acid or HA inside, tend to have the added benefit of having hydration. However, it's probably the most important, knowing what the preference is. So if the patient has got a good feeling for one or the other, then we do that. If the patient wants a little bit less downtime, I think a lot of the machine-based treatments tend to have a bit less downtime. And if the patient wants a little bit more hydration, as I said, you choose the injection-based treatments. But if the patient has got high expectations or wants a more obvious result, I think those two are probably synergistic.
Yeah, I
They should
guess
do
it's about, communicating with the doctor and telling the doctor what you want so that the doctor can customize the treatment to your
plan
needs, right?
instead of
Yeah.
just one.
That's right. So I think we talked about, the different kind of skins and all that. Does it mean that skin booster is only for older people? Because older people tend to have drier skin. I mean, I do. I'm actually quite old. But yeah, so is it only meant for older people? Can young people do it? And if so, how young should you actually start skin boosters?
Wow, that's a really difficult question. Yeah. I think you're only as young as your mind. So once you feel that you wish to improve your skin, I think you can generally see the doctor. So I think that I would group into a few different categories. So in terms of anti-aging, I think most of us start to feel a bit of age at about early 30s. And about mid 30s, we tend to want to seek help for that.
Yes.
And there's also a time whereby we are a little bit less poor. We've worked for some time, and this is when we start doing a lot of these category 2 and category 3 skin boosters, which are anti-aging in nature because they are collagen stimulation and they have got rejuvenation. Whereas there are some people who just want to look glowy, and they might need it for their work if they are models, and even though they're very young or they're influencers. That's you.
No lah.
Yeah, you. Yeah, if you're famous, right? Then you can start a bit younger, and I think the category 1 is pretty good.
Those that we want to go out without makeup and still look decent.
Yeah, that's right.
Okay.
So actually, how often should we be doing it? For just one type of skin booster. What is the treatment protocol? Is that what you call it, the protocol? Yeah.
There's no hard and fast rule. That in general, I think that there are skin boosters which require just one treatment. Most skin boosters require 3 treatments initially, 1 month apart. And lastly, I think the last group of skin boosters require maybe just 2 treatments, 1 month apart. But there's no hard and fast rule. It really depends on your budget, the degree of improvement you want, your lifestyle, your preferences. There are a lot. Just because doctors or the manufacturers would recommend a certain frequency doesn't really mean that it has to
Actually,
be.
it's interesting you brought it up. You mentioned that typically should be 1 month apart. Actually, I heard from a friend the other day that she was doing it like every 2 weeks. Is it
wow.
too close? Yeah. Is that too close?
I think certain skin boosters like the PN skin boosters, 2 weekly is okay. But I think 1 month is a little bit better in terms of convenience, in terms of coping with the downtime and the recovery. Yeah. But I think that when it talks about repetition, I think category 2 skin boosters are probably very important because category 2 depends on stimulation of collagen. And remember, like during COVID, when we had to we had to get injected with vaccines. So these boost the antibodies up slowly, sequentially. So one time it goes up, comes down a bit. Second time it goes up, comes down a bit. So it's a bit like, if you draw a graph or curve, this looks like that. Same with collagen-stimulating skin boosters. So they come in various preparations. However, they require boosting, to get enough collagen. So some of these have certain compounds in them called PLA or poly-L-lactic acid. Some of them have CAHA or calcium hydroxyapatite.
There's one popular one recently. I was researching again, the CAHA.
Yeah, that's right. Yeah, so that's pretty new. So these are agents which stimulate collagen. Okay, so they are there, and whenever as long as they're there, they would ask the body to do something. So they are cleared really, really slowly. They last a very long time. As compared to these signaling skin boosters or regenerative skin boosters, which go away pretty fast. Okay, so they are actually completely different, although we kind of get the idea that they are pretty much the same. So yes, I think the latest would be CAHA-based skin boosters, but they will need repetition. So whether it's PLA, whether it's Kaha or some other novel skin booster.
So
in
too many
category 2.
acronyms to remember.
Yeah,
That's a lot.
yeah. So I think just keep it simple. Let's just talk about categories, and combination of these categories, and discuss with your doctor. And I'm sure you will find customized, tailor-made treatment for your skin.
So I think all in all, I mean, thank you, Dr. Terence Tan from Halley Medical Aesthetics for coming to this podcast and discussing about
And for
skin
answering my
boosters.
questions.
Yeah, and thank you, Sini, for coming and sharing your experiences with us. So I think at the end of the day, it's about skin booster is about improving, not just about your skin hydration, giving you the glow. It's also about boosting your collagen, giving your face a bit more plumpish, more healthy look. But at the same time, I think if you have any other questions about how to treat your acne scars, your fine lines or wrinkles, I think it's the best to just consult the doctor, on whether one treatment is enough for you or whether or not you should combine different treatments to get the result you want. Anyway, so if you have any, questions about the treatments that you should be doing, please reach out to Dr. Terence Tan at Halley Medical Aesthetics. And thank you, Dr. Terence Tan and Sini, for coming onto this
Thank you
podcast,
for
spilling
having
the
me.
tea
Thank
with
you for answering my
Halley.
questions.
Thank
You're
you.
always welcome.
Thank you. Thank you for tuning in, everyone. So like and subscribe our channel. See you the next time.
So for example, just a few injections.
Cannot
and it
say-
works really well.
For example, again, we try.
Oh, yeah.